Hello, welcome to Together San Diego, and thank you very much for joining us today. I am Paola Hernandez Jayo. Our guest today is Dr. Manish Sheth, Division Chief of the Psychiatry Department at Tri-City Medical Center and Director of Achieve Medical Center and Sokia Health. Today we will be hearing from Dr. Sheth about the Delta variant, new mask guidelines, and mental health. Hi, Doctor. Thank you for joining us. How are you?
I'm doing well. Thank you for having me.
Thank you for being here with us. There's a lot to talk about, Doctor. Mental health has been a big issue with the last year with the pandemic. It's continuing now. There's also nervousness with people and students as they go back to school. First, let's talk about the Delta variant.
Yes, so I think we, as a community, as a society, and as medical providers, we were getting very excited as things were progressing this summer with control in the infections and positivities. And certainly, Delta wave has created a new set of anxiety. By now, there is enough information, scientific and based on data, to know that Delta variant is at least twice as virulent as previous variants, meaning it is more infectious. More than 90% of the new infections that we are noticing are coming with Delta variant. More than 90% of hospitalizations that are happening are with Delta variant. But the good news is we understood from the data that vaccination with all different vaccines that have been used so far in the market has been helpful to protect from Delta variant. So less than 0.1% infections are happening in those who are already vaccinated, and it is protecting them from Delta variant.
The other thing that we have now, and I agree with you, I myself, for a short while there, took off my mask, but now I'm back to wearing my mask inside grocery stores. I'm back to wearing my mask anywhere that's enclosed, even though it's not mandatory where I live. Tell us about the new mask guidelines for indoor, as well as the new testing requirements and mandatory vaccinations.
Yeah, so if we are, all of those who are following the news may have seen the directives coming from governor's office that in terms of the new mandatory guidelines, that all healthcare workers have to be vaccinated by the end of next month. And of course, if there are any exceptions, then those workers need to be tested every week to make sure that either they are not positive, to protect themselves and other clients who come in their contact. In terms of wearing masks, the most recent recommendation is that if you are in a community where there is presence of Delta variant, and if you are in any indoor setting with other people in that indoor setting, then please wear mask. The biggest challenge with Delta variant is that the infection starts in the virus particles, they start multiplying very quickly, much faster than what we had seen with the previous variant. So a person may not realize that they are infected because they may not have the symptoms, but they are already spreading the infection. So for that reason, it is advisable, recommended that if you are in any indoor setting where there are other people, vaccinated or unvaccinated, that you wear mask, because that will protect you, your loved ones, and others around you.
And talking about protection, what can we do for our children? We'll get into the mental health about our children and our families, but what can we do to protect our children? I know 12 and over are able to get vaccinated if they choose to do so. And then under 12, though, there's many of us, including myself, I have a 5-year-old that have those questions. As my child is going back to school, what do I do with any anxiety I may be feeling, with anxiety that maybe teenagers, students, even young children are feeling right now? Our mental health is very important, Doctor.
Absolutely. So I guess the big picture is that we want to use this anxiety to make positive changes. So we know that there is work in place, that there may be a vaccine coming out with emergency use authorization for 12 and under soon. But until then, we want to make sure that our kids understand two parts of it. One, they need to be protecting themselves, understand what they can control, washing hands, wearing masks, going back to school, and keeping some distancing when they're indoor, not hugging and kissing. But also at the same time, as part of their growth processes, We want them to do outdoor activities, play outdoor sports if you can, play or have outdoor play dates if you can, stay connected with their friends on FaceTime and other kinds of social media platforms as much as they can, but not do certain things until the vaccines are available for them. But I can totally understand your anxiety. Our youngest is 15-year-old, fortunately vaccinated. So I have a little bit of a different path here to look for.
Yes, definitely, doctor. But it's good to hear the advice that doctors are providing. And in this case, thank you for sharing that information with us. Let's get into mental health now, doctor. The last year, the pandemic has been very hard. It has been affecting many with mental health. It's been affecting with isolation. And now with the Delta variant, some of us, and I include myself on the list, I'm starting to stay home again. I'm starting to feel a little bit isolated. It's my decision to do so. But what can we do? I still continue to do activities such as, go for walks outdoors where I feel comfortable doing that, taking my daughter. But what can we do about our mental health? What are something that you would recommend?
So I think I would like to start by saying that it is all the recommendations are about when we use the word social distancing, it's somewhat of a misnomer. We should be using the word or the term rather physical distancing. We don't need to socially distance ourselves. We only need to physically distance to the extent that is still safe for everyone and ourselves. So that's one piece of it. But what we can do more clearly is that improve our self-care tools. So which includes some of the things that you said about going for walks. And at the same time, we want to have either some kind of outdoor meets or social media meets. We need to put in kind of specific times for exercise, healthy dietary modes, healthy sleeping habits. One of the things we noticed as part of my practice, I'm a psychiatrist, is that during this time, I saw a lot of people increase their alcohol use, their substance use, their sleeping patterns were off. They were, the other thing that came up was some partner relationship issues when we are put together for longer times that we are not used to. So self-care, 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 that's what I would say is most important. And then if someone needs to have a higher level of care, the good thing that happened during COVID times is that almost all the mental health services modified themselves and became available on telemedicine. So any therapist, any doctor, any coach that you would have thought about seeing, almost all of them are available on telemedicine to seek out for help. It's actually easier now than it was pre-COVID to reach out to the doctor because you don't have to be stuck in the traffic for an appointment to go see a therapist or a counselor. So I think it's all three different layers of care that is available.
Doctor, when you and I spoke, you also mentioned that with this telemedicine, we also have the advantage of being able to join maybe our parents, seniors in our family to some of these appointments when they're done via telemedicine.
Absolutely. The one set of population, specifically the seniors, they are most impacted because they are not used to this kind of isolation. Second, they are at a higher risk of getting infected and probably negative outcomes because of their health concerns. And number three, some of them may even have difficulty initiating the technology platforms. So I think the short break that we all got, hopefully their family members were able to teach them how to use the devices, maybe bring them devices with one touch or one click. It is very, very, very important that we keep our seniors engaged, especially seniors and their grandkids, because these are the two target populations that we have to protect at this time.
And doctor, when we talk about some of the key measures that we need to be aware of, what are they when we're observing ourselves or loved ones in order to maintain an adequate level of mental health? Because some of us may not be aware.
Yes, and many times it's our loved one around us who tells us what if something is not going right. So sleep, any substance use, and diet. I think these three things have to be monitored very closely. And if there are any major changes happening, either sleeping too much, too less, sleeping in until noon or sleeping in late, I think those are the kind of things that should be monitored. And if anyone feels difficulty managing their day-to-day job, their daily activities, going to school, teaching, working, then that's a big red flag that should be addressed right away.
Thank you very much, doctor. Thank you very much for your expertise and for sharing with us what we can do for our mental health, sharing with us about the Delta variant, about vaccinations, and also now that a lot of schools are going back, what we can do to handle the stress of sending our child back to school. Something else that you would like to add, doctor?
Yeah, I would say, as I mentioned earlier, there are several resources available. healthcare providers, mental health providers are available online on telemedicine. So please seek out. I'm part of a couple of organizations that are shown here, SoCA Health, Achieve Medical, Tri-City Hospital. There are resources available. Please seek them and please use them.
Thank you very much, Doctor. And talking about resources, I'm going to go ahead and share on screen the websites where you have more information. Tell us about some of the resources. For more information, they can visit sokiahealth.com and tricitymed.org. Tell us on Sokia Health some of the resources and information that you have there that our audience can visit.
Yeah, so as someone may benefit from talking to a coach maybe a couple of times. Someone may benefit from talking to a therapist for a few sessions. Very rarely someone may, from this kind of stress, may be a good candidate to see a psychiatrist. So at SoCA Health, we have all levels of services available, and everything is available online. Easy way to get in and out in terms of signing up. Tri-City has been in community for several decades. They have amazing outpatient program, psychiatry, mental health program called intensive outpatient program to support clients in North County. But again, right now they are available online, and they can offer services to pretty much anywhere in the county for clients who can join online. So please reach out to them. The contact information can be found on websites or on this station.
Yes, and also, Doctor, I'm sharing your social media, Facebook and Instagram. They can follow as well at Tri-City Medical Center and at Sokia Health. They can follow you as well, Doctor. Something else that you would like to add?
Yeah, it seems like it's a nice day out here in San Diego today. Once it gets a little cooler, please go out, get some fresh air, and regenerate yourself. Be outdoor as much as you can.
Definitely. We are very fortunate to live in San Diego with this wonderful weather. Thank you very much, Dr. Sheth. I greatly appreciate your participation on our show today with this very important topic. I also want to say thank you. I shared on screen Bertha, who sent a positive comment saying that this was good information. Thank you to all our viewers. And if you would like to view more of these Together San Diego live streams, you can visit san diego uniontribune.com/Together SD Live. And if you would like to watch more of the San Diego Union-Tribune live streams, you can visit san diego uniontribune.com/UT Today. Thank you very much, Doctor. A pleasure to have you on the show. Have a wonderful day. And I'm going to take your advice. I went for a walk last night with my daughter. I enjoyed the fresh air. We had fun looking at the flowers, the decorations our neighbors have. And it also made us look forward to something. Halloween is coming up, Christmas is coming up, and we can see those decorations and start going out for walks in our own neighborhood and enjoy the fresh air. So thank you very much, Doctor. I'm going to take your advice, and I'm going to go for a walk today with my daughter as well.
Well, stay positive, stay active, and stay safe. Thank you all.
Thank you very much, Doctor. And thank you all for watching.
News is more important today than ever before.
I'm currently outside Otay Mesa Detention Center.
I'm about to get a report at Sharp.
Out at Sunset Cliffs.
COVID testing site.
We live for these times when we're able to bring the news into the homes of people who need it the most.
I thank all of you for supporting our work.
When you subscribe to the paper, you're telling us that you believe in what we do.